Good morning, everyone. I think now that my computer is reading 9 o'clock, it's legal for us to start. I want to welcome everybody. My name is Louise Mitchell. I'm an advancement officer in the development department of UMass Dartmouth, and I'm also a proud alum. And it is my pleasure to be joined by my colleague, Crystal Blaze, who is the communication specialist. And we are so thrilled, and also our star of the morning, Assistant Dean of the College of Nursing and Health Sciences, Karen Barnett. And we are thrilled to be able to be here on homecoming weekend and welcome you to join us for our festivities. Karen is going to give us a little bit of overview about the growth and expansion of the College of Nursing and Health Sciences. She'll go into a little bit of, I'm sure, the merger that we had about, Karen, I think it's about 1.5 years ago, of the College of Nursing and the College of Health Sciences coming together, MedLab Science. So thank you all for your support of our campus in many, many ways. We're very proud to have you join us this morning, and there will be time for questions at any point if you want, but at the end especially. Crystal, I'd love you to add any instructions or any welcomes in that you'd like as well. Again, thank you for joining us.
Sure, we'll get started in a moment. If you could mute yourselves while Karen is presenting, and that will help everybody to be able to listen to the good news coming from the College of Nursing and Health Sciences.
Well, good morning, everyone. Thank you for coming, and thank you for taking time out of your Saturday to join us here and learn a little bit more about the College of Nursing and Health Sciences. I have been with the college for about 3 years. I started in July of 17. I come from Connecticut. I was the dean at St. Vincent's College in Bridgeport, Connecticut prior to taking this role. And then prior to that, I was at Southern Connecticut State University as the director of the undergraduate program. I love UMass Dartmouth. I love working here. I love being here, and I love the students. So it's really been a pleasure to be here over the last 3 years. I earned my undergraduate degree from Southern Connecticut State University, my master's at Sacred Heart University, and I have a DNP from Case Western Reserve University in Ohio that I got in 2010. So my interest really is around nursing education and nursing outcomes. I love accreditation, CCNE, that kind of thing. So I do a lot of work with that right here at the university and in the college. And have been doing that for quite some time. In the 3 years that I've been with the College of Nursing at UMass Dartmouth, we have gone through some changes. As Louise mentioned, in the summer of 19, we merged the College of Nursing with MedLab Science program, which was in the College of Arts and Sciences prior to the merger. And we changed our name to the College of Nursing and Health Sciences to encompass both of the programs. So MedLab Science is a smaller program than nursing. Typically takes about 20 students a year. This year, the university asked that we grow that program. So the program has grown. We took 30 students last year. And the intention over time, over the next few years, is to really get the program up to about 60 freshmen each year being enrolled, which is very doable. It's a very popular program. And now that we're working with admissions to grow the enrollment, I think that more people are becoming familiar with what MedLab Science is, and it's becoming much more popular. So it's a really a great program, and it's been a great addition to the college to have the collaboration and the interprofessional opportunities to work with them. The nursing program itself, undergraduate program, we typically take about 115 students a year. Last year we took a little bit more, we were closer to 140. And this year again, we're probably closer to 130. Even with the COVID circumstances and students learning online, we still had a really robust enrollment this fall for our freshman class. And I think that has a lot to do with the really reputation of our program. That's still excellent in the community. We still draw really strongly from our local community. And we have really good pass rates on our NCLEX exam. So all those things really play into our ability to maintain a really good enrollment despite everything else that's going on. Our NCLEX rates this year were 95%. And I should say this year, I'm talking about students who graduated in 2019. 2020, we're just getting our rates in now, and it still looks really good. We've had about 80% of the students who graduated have taken the exam, and of those 80%, our pass rate is 96%. So that's a little unofficial because we still have a bunch of students who are outstanding. But even with the circumstances of COVID and students not having a typical senior spring semester, they were successful on the first time NCLEX. So we're really proud of that. The Dion building itself has gone through a number of renovations over the last couple of years. For those of you who have learned there and used the labs there, it's truly a remarkable change in each of the labs. So we have 3 labs that we use for the nursing program. The first lab that got renovated was our skills lab, and it really needed it. So it got renovated, all new equipment in there, removing walls that were kind of making it an uneven space. So now it looks like an open bay with beds in it, so that students can practice. There's also technology in there, so that students can learn, sit at desks and learn, and big screen TVs so that they could watch videos on them and practice their skills. And it's a really beautiful space. Last summer, we renovated the assessment lab, which if any of you remember, our assessment lab was all very small private rooms that the students would go in with another student and practice, but it wasn't open so that an instructor can watch all the students at once. It would be one faculty member going into each individual rooms. So we took down all the walls in there and no more individual rooms. It's just a wide open space now. Again, with bays, with state-of-the-art equipment, and lots of area for students to practice. There are tables and chairs in there, and again, technology, so they can watch videos or faculty can lecture in there if needed. But it really is a workspace, and it's set up to be a workspace. In addition to the open room, we have 2 more private rooms. One is for psych mental health assessment, so it's set up like a psych mental health office, which is very nice. And then the other private space is a set up to look like a home, so that we could do some kind of community, either simulations or practice, where people can go into the home space with a little kitchenette in there, so they could kind of do an assessment of what a home looks like and how safe it is for those people living in the home, and make some suggestions that way. So those two new spaces are really special for us and very new and different, and really offer students different opportunities to learn. There's also a goal of getting, we have one space in there that kind of hasn't been renovated yet, but the goal is to do a telemedicine room at some point so that we could practice with the undergraduates and the graduate students. And I think we all know, after going through this event with COVID, how important telehealth is. It's always been important, but even more so now. So that is one of the future goals for that space. And then the third part of the renovation took place over winter break last year. We renovated the simulation suite. So the simulation suite actually wasn't that old, but the equipment in it needed renovation. So the equipment and technology was upgraded. So although the space itself doesn't look physically different, the technology was definitely upgraded. It's much faster now, much more useful. And we also added the ability to run all 4 simulation rooms at the same time. Prior to that, we were only able to run 3. So the addition of that extra room really allows us to run more than one specialty in there. So we can have some students doing med surg, some students doing maternity, some students doing pediatric, all at the same time, because we have those 4 separate spaces now. The other part of that was to build debriefing rooms so that after the students do the simulation, they have a space to go to view the video of their simulation and to discuss it. So those debriefing rooms were built in a long hallway behind the assessment lab. And those are actually really beautiful spaces. They're 4 private rooms with the big screen TVs, tables, chairs, It really is remarkable when you see it. And I really hope all of you get to come to campus and get a tour so you can see the difference that it makes, because it really, the students love it. We get more and more compliments on it from students, but also faculty really enjoy working in the space. It really makes a big difference. So as far as the graduate programs, we do have a new certificate program for graduate students. We have a advanced graduate study for psych mental health practitioners. It's an 18-credit online program for nurse practitioners. So nurse practitioners that are already licensed can earn a certificate in psych mental health. We discovered the need for that, or we were aware of the need for it, but really got support from our practice partners who were looking for more psych mental health specialty nurses. There's a real shortage of psych mental health nurses in the area, and they did ask for a program. We have a psych mental health nurse practitioner program. It's part of our DNP, but it's earning the nurse practitioner. So this program is specifically for nurse practitioners who are already licensed in order to earn a certificate. So this is new, it's starting in the spring. It is 18 credits, but the goal is that students or nurse practitioners can finish it in about 3 semesters. So it's very exciting, we're excited about it. And we expect really to have good enrollment in that program because there is such a big interest in it in this area. Any questions or concerns or?
If anybody has any questions, feel free to unmute yourself and go ahead and ask, or if you'd like to place it in the chat, we can do that too.
Good morning. I'm a graduate of the RN BSN program back in 1973. What happened to that program?
That program still exists. It's still I don't know if it was online when you were in it, but it is a fully online program now. We have typically about 50 to 80 students enrolled in the program, and most of the students get through it in probably about 2 years, 2 to 3 years, but it is still a very popular program, and being online, we draw students from across the country now to the program. So thank you for
I love the view of the campus behind you. I now live in Florida and I haven't seen the campus in many years, and it's absolutely gorgeous. And as I remember it in the 70s.
Yeah, it is. It really is a beautiful campus. I mean, I love walking around in it. It's just gorgeous. And this time of year, it's particularly beautiful with the changing and even the flowers, the way they do the flowers when you come onto campus, it's really very impressive. Anything else? Any other questions? All right, I'll just talk a little bit about the undergraduate program again and some of the changes that are going on. We do have a new curriculum, which is very exciting for us. This is the first year of our concept-based curriculum. So we had a traditional medical-based curriculum for the last 30, 40, 50 years of the program. You know, it's updated obviously as needed, but no major overhauls have been done. So when I came in 17, one of the things I was asked to work on was the curriculum committee and working to transform the educational model. And a concept-based curriculum is going to help us to do that. It really puts the onus of the learning on the student. It pulls the faculty away from the lecturing and really does more kind of activity-based clinical learning for students, even in the classroom. So the focus really is bringing clinical into the classroom. And many of you probably know this already, but the licensing exam is changing in the next couple of years to focus much more on clinical judgment. So the types of questions are going to change. The look of the exam is going to change. And the plan for that is 2023. So part of this kind of change in the curriculum is helping us to get ready to prepare students to be successful on the exam, because it is going to be different. It's going to be more challenging or challenging in different ways for students. They're really going to be asking students to think at a higher level. So the concept-based curriculum helps us to do that with students. It focuses on larger concepts rather than individual diseases. So it really allows the student to understand a concept and then be able to apply that knowledge to any situation that they're in. So we're really excited about it. We've been working with Linda Caputi, who's kind of an international specialist on education. She comes to campus twice a year and is really helping us with the change in the way we educate the students. So we've decided what concepts we want to teach them and how she's helping us really institute the activities that are going to help us to be successful. So it's all really exciting. Again, this is the first year of it. Unfortunately, we still have to teach out our other curriculum. So the students who are in that curriculum will stay in that curriculum, but our new freshmen are in this new concept-based curriculum. So it's very exciting for all of us. We also really have a new advising model in the College of Nursing for all the students. For the first time, we have professional advisors. So it's the advising load has been taken off of faculty. So it's really all freshmen are being advised by this professional advisors. We have 3 of them in the College of Nursing and Health Sciences that cover the freshmen in both nursing and med lab science. The goal of the professional advising team really is to help students to integrate into the programs and to build teams so that they feel supported by each other. And we found over the last couple of years that the students who are integrated better into the program have built these teams, are more successful, and it's really impacted our retention. So we do a student nurse leadership academy every summer, and all of our freshmen come onto campus during the summer and attend this 1 to 2 day session. And really the focus is team building. It's how to work together, how to support each other. And each individual student is assigned another student to be a peer mentor. And that's also been very successful in helping the students to stay in the program, I think, more than anything, and not give up when they get stressed out. Students, we found over the last few years, really struggle coming to college. A lot of them feel very alone. There's a lot of mental health issues. A lot of them don't really know how to take care of themselves. So rather than focusing totally on their education and academics, we're trying to take a more holistic approach and really focus on what the students need besides their academics. And some of them just need somebody to eat lunch with, or have somebody to talk to at the end of the day. And those are the kinds of skills that we're trying to build with this new advising model. So it's been going on. This is the 3rd year of it. And again, it's been successful. Students seem to really grow a little bit faster in the professional role, understand what the professional role is. And again, we have good retention rates. And we do think some of that comes from this advising model. And then lastly, I'll just tell you that we're in the last year of our HRSA diversity grant. We got a grant 4 years ago to help increase the diversity of the nursing graduates, which we would hope would lead to an increase in the diversity of practicing nurses in the field. So it was a $4 million grant, and we worked to increase our diversity. And we have done that. We've been successful in small amounts. It's not huge, but I think our success, again, is more in the retention of our nursing students rather than the enrollment of a more diverse students. So we are able to retain the diverse students and graduate more students. So that's been a fun grant to work on. It's been a lot of work, but we have been able to put some programs together that helps with retaining the students. And I'm happy to take any questions, comments, suggestions.
Well, okay, well, I have a question. Are your students mainly in residence or commuters?
I would say for the nursing program, it's probably about 50-50. About 50% of them live on campus, but again, we do draw from our local area. So about half of the students do live at home and commute. So.
Karen, I'd like to follow up on a little bit of what Dr. Pierce was just mentioning about, students on campus and their education. I know that working on campus myself and being an alum, I know a lot of time and energy went into planning for this year. I know there was a lot of discussion about safety and protocols and how to move forward and tweaking not only just safety, but also the curriculum and how are kids going to learn at home and what was it going to mean for the freshmen who really don't have a connection like a sophomore and junior might. So I was just wondering, after now we've only been in, 6-7 weeks or so, or not even, I was just wondering if you'd comment a little bit about what you planned and how it's looking in reality on what's going on now on campus with your college.
Sure. So the pandemic did impact the nursing program and MLS pretty significantly, and really starting in the spring, because as soon as the hospitals started to get flooded with patients, most of them asked that we not send our students there at that time, and mostly out of just the unknown. We didn't have enough information to know how it was going to affect our students, and there was a need to de-densify to some degree and keep the nurses who were working at the bedside safe. So we instantly had to change in the spring semester so that our students were able to meet their outcomes, especially our seniors who needed to finish and graduate. We didn't want to impact that at all. So immediately in the spring, we had to pull the students out of clinical and bring them back to campus, and then once campus closed, find ways to teach them at home. And again, it was really the clinical part that was the challenge, because we wanted them to be at the bedside. We wanted them to have that hands-on, and we wanted to make sure that they met the course outcomes. So we went to a virtual model, and luckily with simulation and really the popularity of simulation, there are some virtual models of simulation that are available to students. So we went to virtual sim, and students were required to participate in the virtual simulations from home, and then typical, or just like what we do in a face-to-face simulation, there's a prep period where the students meet with the faculty, similar to what we're doing now in a Zoom, to prepare for the virtual simulation. And then the students would go off and do the simulation on their own, and then they would meet again after the simulation with the faculty on Zoom to discuss what went on. So we tried to simulate as much as possible what they would see in the clinical area. And it was interesting because this summer I was at a conference, a virtual conference, and they were talking about the virtual simulation and how they really felt that more research needed to be done on the outcomes related to it, because unlike hospital experiences for students, when you're doing virtual simulation, every student gets to see the same patient and gets to have the same experience. And that never happens in a hospital because you don't know what you're going to get. So this is different. And as much as we want them to be in the hospital and at the bedside, this is a different opportunity and a different way to think about clinical. So it was kind of interesting. And the other thing with the virtual sim is, as students are doing it, every click gets recorded. So we can look back and see where they're missing, where their clinical judgment is, and give us some idea about student outcomes almost instantly, which is kind of interesting. So that's what our students did in the spring. It worked out very well. The students missed being in clinical, especially our seniors, because that's a big kind of capstone experience for them in their senior year. They go and work one-on-one with a nurse, and they really look forward to that. So it was different, and we were concerned as to whether or not it would impact our licensing exam scores, but it has not, which is another interesting outcome. So thinking about what our students needed for the fall, and it was a kind of back and forth all summer long on whether or not we were going to be on campus or not be on campus. When the decision was finally made that most things would not be on campus, we did propose that our students be allowed to come in for labs at both MLS and nursing. And we were given permission to be on campus for our laboratories. And all of the practice partners, or at least most of the practice partners, agreed to have our students back. So our students are in clinical. They are on campus at least 2 days a week doing lab. We had to de-densify. We have very small groups now, where our clinical groups used to be 8 or 10 students. Now they're 3 or 4 students per clinical group. And that is a request from our practice partners. So the hospitals want smaller groups. And then on campus as well, in order to socially distance the students while on campus, we do have to have the small groups. But again, it really is a benefit to both the faculty and the students to have those nice small groups. And I think the learning, we'll see that the learning really has improved with the smaller groups like that, both in clinical and in the labs. All of the classroom, the didactic is virtual. It is synchronous in nursing. So it is Zoom meetings where the faculty and the students meet together. Kind of different than the RN to BSN program, which is asynchronous. So the students can go on whenever they want and listen to a lecture and, you know, submit their work by their due dates, but it is not with a faculty face-to-face, where our undergraduates still need that face-to-face. So they are having face-to-face synchronous lectures online. Our freshman students only take 1 nursing class each semester, and the rest of their classes really are the sciences. So they take chemistry and anatomy and physiology, math courses, which are pretty tough for our freshmen typically. And this year, I think they're even more challenging because they're online for the students, including the labs. So freshmen are having chemistry lab online and anatomy and physiology lab online. So it's different. It's a different way of learning for our students. But like I said, our enrollment was still good. We still have a nice, robust freshman class, and we're halfway through, and they're all still hanging in there. So we're happy. We're happy for that.
Thank you, Karen.
So I'm curious, having taught at UNC Chapel Hill for over 30 years and always used to a model where we send 1 faculty member with every 8 students. You have to send a faculty member with every 3 to 4 students? And where are you getting all that faculty?
Well, you know what we did, and we had to figure this out because that was definitely a challenge for us, is we split the day up for students too. So an 8-hour clinical day, students, we have a group of 4 who go in the morning and then 4 who go in the afternoon. So they're getting fewer hours of face-to-face with students, and we did have to increase the lab and simulation time, because that was definitely an issue. Yes. And we typically don't use extended care facilities or nursing homes, so that wasn't an issue for us. But a lot of the community agencies are hesitant to have students back. So that's our other challenge right now, is really community agencies going into home care, things like that. So community is really being creative this year. You know, they're doing flu shot clinics, they're doing contact tracing, and things like that. So it's a little bit different, but working out okay. You know, it's different for everyone, but I don't think it's all negative. I think we're all learning a lot, and I think once we have time to step back and evaluate what we're doing now, I think we'll find some really good teaching, different teaching techniques that we can implement into regular curriculum.
Yeah, change is typically very difficult on the faculty, not so difficult on the students, but very difficult on the faculty. I'm just wondering, in general, how do you think faculty morale is?
I agree with that. I think that is the biggest challenge that we're having right now, is with faculty morale. But I think they're starting to feel better about it now. And I'm saying that because it took about halfway through the semester until everyone's kind of comfortable with all the changes now. So yeah, it's been a challenge. You know, there just came an article out from AACN about mental health in faculty and how we really have to start looking at that. Typical to the nurses at the bedside, all of this change that faculty's going on really needs to be addressed as well. And it's been challenging. You know, faculty love being on campus with the students, so it's really hard being a distance from them. and not seeing them every day. But even just taking a whole course and putting it online, when it's not really the online format that an online program has with the smaller groups of students. You know, we have classes that have 60 students on them, and you're doing that in Zoom. So it really is a challenge. But they've stepped up, and things are getting done, and students are being successful. So we're proud of them. And I wish we like the Dean Christopher and I talk about this all the time. We wish we could do something with them. You know, if we had a budget to send them all flowers and say thank you, that would be great. But it's just, unfortunately, all we can do is say thank you at this point. Any other questions?
I just wanted to ask Karen, going forward into, I know that you're just in the beginning of the fall semester, but what are your thoughts with regard to, you know, spring semester, which of course starts late January, early February? Are they going to be using a lot of the same models that you feel are successful now, and then have the opportunity to tweak them a little bit depending on what goes on this semester? Or what are your thoughts on that?
Yeah, you know, I think that being halfway through the semester now, and like I said earlier, everyone's kind of just getting into the swing of things, and getting used to the way we're doing things, getting used to wearing personal protective equipment when they're in the labs, and students and faculty kind of doing their own cleaning and things like that. You know, it's challenging, but I think we're kind of in the groove now, and I'd like to see us just continue to do what we're doing. I don't think we need to make any major changes. I think we are seeing that what we're doing is working, although it may take a little extra time and a little extra work on everyone's part. It is definitely allowing us to meet our outcomes, and the students seem to be doing well. So it'll be kind of interesting to see what happens with the freshman class, because this will be the first freshman class that we will really see the difference in the online. But students are resilient, so I think we'll see that they do okay. But yeah, I think we just need to continue on with what we're doing. If things stay the way they are now, I would assume that all our practice partners will allow us back in the spring, which would be great. Excuse me. And our senior students should be able to do their mentorships, which is the one-on-one with a practicing nurse. And I think that will benefit them to a great degree. We have an accelerated nursing program, which is a 17-month program for students who already have a degree, a college degree in another field, so they can earn a bachelor's degree in nursing in 17 months. And those students are currently doing their mentorship. They do it in the fall semester. And we've been able to get that in place so that they each have a mentor to work with this semester. And that's been going very well. So really our goal is to have that for all 93 of our seniors in the spring semester, and have everyone else who needs to be at clinical sites in the semester, in the spring. And I do foresee that that will be possible. I think that for the most part, our practice partners are kind of in the groove now. They are handling what's coming. Unless we have another huge wave, I can't imagine that they would deny us access to the clinical sites. So.
Karen, what are some changes that you made to the program or in teaching methods that you think are beneficial, that might stick around regardless of the conditions that meet us in the next 2, 3, 4 years?
Yeah, well, I think definitely the virtual simulations. I think that is going to be an area of huge growth. Just because it's a model that really allows us to measure student outcomes almost instantly. So I think that's a really nice tool to have. It allows us some flexibility with students. So even if students are going to the clinical settings, we can still use the virtual sims in addition to that. So we may keep the model of having smaller clinical groups that go half a day, and then in the afternoon, while the student's home, they could do a virtual simulation and have an experience of a patient that maybe they're studying about in class. So if they're in a class where they're learning about, surgical procedures, they could take care of a surgical patient virtually. and have that experience. And like I said, all the students are taking care of the same patient, so they're all getting that same experience. And we're able to model and we're able to measure that outcomes of the students. I also think there's some benefit to faculty doing some of the coursework online. It allows some flexibility for the students who maybe, you know, have an ill child at home or can't come to a class because they're ill themselves, so they can access the information that way. I do think that the faculty are anxious to get the students back on campus for those kind of activities, and it would be nice to have them back. I don't know if we'll ever go to a totally virtual you know, learning situation when we do get back to normal, but partially would be nice. And then the other thing we instituted was a testing package, an exam software package where students can take their exams online, not online, they could take them on computers so that each student has their own computer. They take their exam on the computer. That data is, the data from the exam is captured. So it's used to kind of evaluate how the questions were. And this semester, we also instituted a proctoring system for that so that the exams could be taken at home. So that's another kind of tool. It's just a tool that we're using, but it allows some flexibility in the way that students take their exams. So that may be something else that we think about in the future, instead of using class time for exams, that they are virtual. So.
And Karen, we had a question emailed in from a nursing alum who was not able to join us this morning. And I'm going to read the question to you.
All right.
There are so many benefits to internships, clinics, and other hands-on experience for nursing students. I imagine most of these opportunities are not available this year. So what are they being replaced with? And is the college simulating these types of experiences or augmenting class learning in any other ways that would sort of mimic some of those things?
Yeah, that's a great question. And that really was our biggest concern in the spring semester, last spring semester, when our students were not able to do their mentorship, because it is such an important part of their transition to practice, is what it is. It really helps to socialize them into the role of a nurse. And we were really concerned about them not being able to have that socialization into their transition into practice. So last semester, we didn't have the opportunity to do that for our seniors, and that's when we really went to the virtual simulation and really allowed the students to have the discussions about their patients, because we felt that was the important part, to discuss or to debrief about the situation that they were practicing in, and really talk about what went well and what didn't go well, why they made some decisions that they made, and if they had to do it again, would they make different decisions now that they can kind of analyze it. So it was that kind of piece of being able to analyze the work that they were doing and reflect on it. That was the important piece of us trying to replicate the mentorship piece of it. You know, it's obviously not the same as being on the bedside and having that one-on-one mentorship, but we wanted to provide the students with some kind of learning experience where they could actually look back and reflect on what they did. So it was more journaling, discussing, reflecting on the activities rather than being one-on-one with a nurse. And then the governor of Massachusetts allowed graduate nurses to work prior to being licensed, which is new for Massachusetts. Pretty much across the country now, they don't let graduate nurses work without being licensed. This year they did, and I think that was an advantage to our students who graduated, that they can go out right away and get a job and start practicing. Now, they probably weren't practicing to the extent of what they would typically do licensed, but at least they were working at the bedside, probably had a mentor. I would think that's the way that most hospitals set it up. So they did get that experience post-graduation prior to being licensed.
Thank you, Karen. Does anyone else have any questions?
Yes, now I'm going to sound like a development officer. What would you say are the schools, the colleges' biggest needs at this point in time?
Biggest needs. Well, you know, I think one of the things our students typically struggle with is their own personal finances. And a lot of our students still have to work in addition to going to school. Some of them are supporting families. You know, I have one student who comes from New Bedford, which is a 15-minute drive, but she takes a bus to get to campus, and it takes her an hour to get to campus on the bus. So once she gets to campus, she doesn't leave because she doesn't have a way to get back and forth. So I think scholarship money is still really, really important for our students to make sure that they have the funds to not only, you know, not work and be successful, but to commit themselves to a 4-year program and graduate in 4 years instead of having to stop out or drop out and then come back because they can't afford it. And then our other really goal of the nursing program is to get that telehealth room up and running so that we can integrate telehealth into the curriculum for our students, both undergraduate and at the graduate level. And we have some global public health programs for our students, and one of them goes to Mississippi. And part of the Mississippi team that goes down would like to integrate telehealth into that trip so that they're not just there once a year. So once they go there and they spend time with the people in Mississippi, they can continue providing healthcare to them through telehealth once they're back on campus. So that's kind of a long-term goal for that program. But in order to do that, obviously we need the equipment and to get our campus room up and running and be able to provide health in Mississippi. So.
Karen, this has been so informative. Before we...
I think, Dr. Pierce, are you trying to say something because you're on mute?
Oh, I'm sorry.
Louise, this is probably a question for you.
Sure.
I mean, I give like a monthly withdrawal from my account amount to the School of Nursing. Is it better to designate that for, it's undesignated, for something special like scholarships or telehealth, or just leave it the way it is?
Well, traditionally, you know, universities across the country love unrestricted funding for their colleges because it allows them, then the dean and people that are making the decisions on where the resources are mostly needed, they're the people that know that the best, as you know from working in a similar situation. So I would say if you have something that speaks really, really strongly to you and makes you want to make an impact in a particular area, then that's perfectly fine. I do think that I know from being in development that unrestricted funds are great, but certainly we always like donors to give to something that speaks to them and is going to be meaningful and impactful for their lives, as well as our students' lives and the college which they support. So that's kind of a general answer to say whatever, but unrestricted funds are always needed, certainly. Then the dean can funnel them where they're best needed. I know that over the years we've raised money for the sim labs and the assessment labs. And Karen is absolutely right when she talks about the need for scholarships. Specifically, I would say, well, not only in the College of Nursing, but I would say the College of Nursing and Engineering are two disciplines that really require students to have a lot of focus and really not have a couple of part-time jobs in order to be successful and get through in 4 years, which is certainly one of our goals, is to get kids in and out of here in a 4-year or as close to that as we can. So to that end, scholarship money is incredibly important because it allows kids who, 60% of our kids, Susan, are Pell eligible. So that speaks to sort of the economic climate that we're dealing with on campus. And most kids, even after they've received everything that they're eligible to, usually have about a $3,500 gap at least. So scholarship money is very important, especially when to the College of Nursing. So thank you for your question. Susan, I wanted to follow up on something else you said a little while ago when you were looking at the lovely background behind Karen. And we have just completed an incredibly new dorm and dining hall, and it's sort of very modernistic and it fits. It's different than the Paul Rudolph design that you're used to, the brutalist design. But it's really, it's great. You can go online and take a look at it, but I would encourage, and I know you're in Florida, but I would encourage anybody who's on the call with us now, or anyone that you're in contact with, if they happen to be in the area or if they live in the area, we would be most thrilled to give anyone a tour when it's safe, even one-on-one with masks, to see the new dorms, because they're quite something and we're very proud. And we think that not only will they make it a great place for students to learn, but you know, it's a recruitment tool as well. So I think it would be great for anyone that's interested to even just drive on Ring Road and look at them. I think you'd be very proud. And it adds a little bit of oomph to the Paul Rudolph architecture.
I have a sister who's also an alum in East Greenwich. I'm going to send her to look at the new dorms.
Absolutely, absolutely. They're very nice, and I think that the students, although they're very limited this year, who's in them. So actually, I ran into a kid on campus last week, and he was skateboarding, and he came over and was chatting with me, and we were right near the new dorms. So I said to him, "What do you think of the new dorms?" And he said, "Oh, they're great." And I said, "Yeah, what is it like being around?" And he said, "Well, that's not my dorm." And I was so proud that he said this, because, you know, around the country, kids are, you know, being busted, so to speak, constantly about partying and being in places where they really shouldn't be. And he said to me, "Oh, I'm a junior." And he said, "You know, I've watched them be constructed over the last year or so," but he said, "I haven't been in them because it's not my dorm and I'm not allowed in." So I was really proud that he said that, because certainly we're so proud of them. We want to highlight it and shout it from the rooftops, but right now it's really limited. But we would love to give your sister a tour, or you, at any time. So we'd reach out to anyone that's interested. We always love having alums and friends of the campus physically here to see what we're doing. Does anyone else have any kind of a question that they want to ask to Karen? Karen, you've been so gracious on a Saturday morning, and as all our callers have been, and our participants, we really appreciate you joining our virtual homecoming. It's, of course, not what we had anticipated, but the staff has spent untold hours trying to develop a day of things that are interesting, from academics to social things to sort of just fun activities for our alums to get involved with. And I know Crystal's been very involved in this, and they've done an amazing job. And if you have the opportunity, go on the website. There might be something else later on in the day that you want to jump in on, even if you haven't registered. I would encourage you to look. Crystal, can you add to that a little bit?
Thank you, Louise. If anybody would like to join another event later today, you can find links to all of them on umassd.edu/homecoming. Thank you all for joining us this morning.
Thank
Yes,
you.
thank you.
It was a pleasure.
Thank you. Bye.
Bye-bye.
Take care.